Good morning, Dr. Piers. It's great to have you on the podcast today. I know you're busy, so thank you for your time today. I say this probably a little too often, but this is a topic that is definitely near and dear to my heart, as long COVID is something I've personally struggled with and know firsthand just how much of an issue it is and how life-altering the condition can be. So yeah, I'm excited to have this conversation with you and to hopefully provide the listeners, any listeners struggling with this condition, with at least some first steps, maybe, if nothing else. Now, I know you started off on the hormonal sort of endocrine side of things, helping women through menopause, and then you moved into this post-viral fatigue world. Beyond that, I'm embarrassed to say I don't know a huge amount about your background. So would you mind just quickly running us through who you are and how you ended up in this particular space?
Yes, certainly. Well, Rob, thank you very much for inviting me. That's the first thing to say. And it's a great pleasure to meet you. My background from the beginning was that I trained as a GP and I worked in general practice for 7 years. And then I realized that really wasn't quite cutting it for me because you didn't have long enough with your patients. And I didn't like prescribing drugs. So, I was always looking for lifestyle changes and advice to give patients. And that took longer than 5 minutes or 10 minutes to cover. So I wasn't feeling very satisfied working in general practice. And then I became a consultant in contraception and reproductive health, and I was asked to run services in Surrey for women for contraception. And all the time I was doing that, I was also seeing women, obviously as a GP as well, for the menopause, perimenopause. They would seek me out. And then in 2016, my career took a slightly different sort of direction because of my daughter. So my daughter, she was how old was she in 2016? Anyway, she was about 19, 20.
Younger than she is now, yeah.
Yeah, younger than she is now. And she had always been chronically unwell, and we never quite could work out what was going on with her. So as a baby from 3 months old, she started developing eczema. She always looked pale. She always had a bit of a belly, a big sort of swollen tummy. But she was so sweet. She never complained. She just got on with it. She was amazing. And then when she went to college at age 16, she got swine flu, and she never quite really recovered from that. So again, an infection, it knocked her sideways, and she was ill for about 6 weeks with that infection. And she was left with fatigue and headaches and more IBS type symptoms. And we just didn't know what was going on, really. But in 2016, she became super, super ill. And that was because she was so fed up of feeling unwell. She decided to eat sort of bullet superfoods and to do lots of exercise. And she was a student nurse at the time. And she was just eating this green, highly nutritious, good for you kind of liquid, which of course was very, very high in histamine. So she was poisoning herself gradually, quite quickly over a 4-week period. And she just became iller and iller and iller. And she, as I say, she's always been very uncomplaining. So she doesn't like to sort of, share her problems with me, particularly, or with anyone. And but then she rang me up, and she came over the first time, and she said, "I feel so ill." She burst into tears, which isn't like her at all. And she said, "I just feel so ill." And I said, "Right, sit down. Let's work out." Now, she'd already become hypothyroid. After the swine flu, she became hypothyroid. And I said, "Let's check your thyroid. Maybe that's gone completely out. Let's see." She gave me a list of loads of symptoms, and I was thinking, okay, what's going on here? Let's check the thyroid first. Grab the low-hanging fruit, and then she went off. And then she 3 weeks later, she rang up in the middle of the afternoon on a Saturday, and she was in tears again. And she said, "I can't swallow anything. I can't open my eyes. I'm in a really bad way." And I was like, "Oh my God, I'm coming round to get you." So I said, are you having an anaphylactic shock? She said, no, I've been like this since this morning. And this was 4:00 in the afternoon. So I went over to get her. Could see that she looked absolutely dreadful. She looked completely different to the last time I saw her. Her skin was all red. Her eczema was dreadful. She was swollen like a sort of balloon. And she just looked awful. Anyway, she grabbed a bag of stuff. She already had it ready when I arrived, and we dashed home. And my husband and I are looking at her thinking, oh my God, trying to look calm, but feeling absolutely panicky inside. And we gave her some water with a straw because she couldn't really, her lips were so swollen and so cracked that it was really difficult for her to drink from a glass. And I said to her, look, you haven't eaten anything. Let me make you some food. I've got some organic carrots, I've got some organic potato, and I've got some organic minced lamb. And I'm going to cook it for you. Keep it simple, and I'm going to cook it for you. So she's sitting there, and she eats some carrot, and she's fine. And she eats some potato, and she's fine. And then she puts some minced lamb in her mouth. Well, Rob, within, honestly, 3 seconds of putting the minced lamb in her mouth, she went bright red, even redder than she was. She looked absolutely awful. And my husband made the diagnosis, actually. He said, it's like she's got histamine. It's like she's allergic to the lamb. Something's happened. And when he said that, it made me think, oh, histamine intolerance. Because a dear friend who was a chiropractor 9 years before had said to me, do you think Jessie could have histamine intolerance? And I had never heard of it. I didn't know anything about it. I looked on the internet then, and there was really nothing on the internet about it. So I was like, I don't know what this is. I'm just going to have to... I'm just gonna have to keep that in the back of my mind. So when he said histamine, I was like, oh, histamine intolerance. So of course, when I looked again in 2016, there was a little bit more. There wasn't a lot, but there was a little bit more. And it enabled me to make the diagnosis and think, actually, she's so full of histamine because of what she's been eating and the list of symptoms and so on. And then we tried to find, well, I said to her, right, we put you on a low histamine diet, but it was difficult to work out what that was because, again, there was not very much information. And I'll give you some antihistamines, but I just gave her one a day, So I was nursing her at home, giving her one a day, looking for a consultant, a professor, somebody to help us. And we saw 6 doctors, and we could not find anyone who knew anything about it. We saw a supposedly top immunologist, allergy specialist in London at the Great Portland, and he was absolutely useless, like a chocolate teapot. I mean, we spent a fortune going to see him. It was awful. He told us to stop the antihistamines for 3 days before we went, so she got worse again. And it was just awful. And he had no idea. He'd never even heard of histamine intolerance. We saw 6 people like this. And then finally, I was introduced to Professor Vic Kular, who's an amazing man, who is a urogynecologist. And he sees lots of women with interstitial cystitis. And when he takes a full history, he has worked out that they've all got histamine intolerance and they've got mast cell activation syndrome. So once we were put in contact with him, he was a godsend, and he talked us through and said, oh, no, once a day isn't enough. You need to give her much more than that. 4 times a day is the maximum safe dose of the fexofenadine. And let me give you a prescription for 180 milligrams, which you can't buy over the counter. And let's give her some famotidine so she can have a type 2 antihistamine as well. And he was brilliant. And over sort of over a 2-week period, she lost over half a stone in weight. And that was all fluid. She was peeing for England.
Yeah, I was about to say, so half a stone, just for the listeners, that's about 7 pounds, or about, 3.5 kilograms, somewhere around there, isn't it?
Yeah. And she was just peeing, and she was drinking 2 liters a day, but every 15 minutes she was going and emptying a full bladder. And it was all the fluid coming out from her body, from her tissues, because she was on now lowering her histamine and the inflammation was going down. So we watched her sort of shrink in front of our eyes back to how she used to sort of be, which was amazing. So we knew we were on the right track. But it took, I would say, 4 weeks for her to be able to go back and live in her flat and to go back to college. And she was, you had to be very patient because it wasn't easy. And when her histamine was super high, she did not sleep a wink for 7 days and 7 nights. Can you imagine? because it keeps you awake, right? And it was just awful. The poor darling, she was so tired, but she could not, and she closed her eyes, she did all the things, but she could not sleep. So it was really galling. And she'd suddenly wake up in the middle of the night feeling, or, when she did finally manage to go to sleep, she'd suddenly feel great waves of nausea and run to the bathroom, and then sometimes be sick, sometimes not be sick. And that was high histamine, much like people get motion sickness when their histamine is high. And she had a migraine. The eczema was so bad that when she moved her neck, her skin split. It was that bad. And in her, all down her arms, it was just appalling. Anyway, it was heartbreaking to see her like that. But it did something amazing because it taught us all about it. And we watched her get better. And then I just kept researching it and learned more and more about it under the sort of mentorship of Fit Kular, which I'm very grateful for. And then I was still working in my contraception clinic at that time, and I would have women come and see me and say, well, which contraception can I use? And I'd take a full history, and they would tell me, oh, well, I've got IBS and I've got ME and I've got this and the other. And I go, oh, I think I might know what you have. And do you know what, Rob? They used to burst into tears because for decades they had been gaslit or told it's all in their head, or there's nothing that can be done for them and they must be a hypochondriac. So these poor people who had been struggling for decades in some cases. And then I would say, oh, no, I think you've probably got histamine intolerance, and let's do this, that, and the other. Here's a bit of dietary advice. Here's some vitamins and minerals to take. Try some antihistamines, blah, blah, blah. And they'd go away and they'd come back with a big smile on their face. And they would say, you've transformed my life. That little bit of advice and help has just changed everything. I actually used to be able to diagnose them across the waiting room because there's a sort of look, a pale look, and I could see it. And I think, oh, they've got it. And I was diagnosing 3-4 people a week and changing their outcomes, their health, which was really satisfying and fantastic. Anyway, I then became a menopause specialist, and I was working at Chelsea and Westminster Hospital, and again there telling loads of women, menopause is a particularly tricky time if you have histamine intolerance, because as the fluctuations of the hormones, the estrogen goes up and down, estrogen increases your histamine release and it inhibits the diamine oxidase production. So these poor women, they think all of their symptoms are the perimenopause, quite reasonably, but a lot of them are because of the coffee they've just had, or the fact that they just had toast for breakfast. And so I carry it. Some of these women are complicated, and when they go to a menopause clinic, who don't understand the histamine side of things, they're just given more estrogen because they're told you're not on enough if you've still got symptoms. And then they go back and say, I feel worse. And they go, oh, you're not on enough. And they increase the estrogen even more. And of course, it just put these poor women into a spiral of acceleration, And so they're a little bit more complex, and you need to tackle the histamine side first and then go cautiously with the HRT. So I was doing that at Chelsea and Westminster and in my private clinic. And of course, people find their way to you, don't they? So my private clinic was supposed to be for menopause ladies, and then I had a whole load of people booking in because they thought they might have histamine issues, and which was fine, and I was helping them. So I was getting all this experience with people who had been diagnosed with a symptom of ME, etc., fibromyalgia, and so on. And then along came COVID. And when COVID came along, I, like everybody else, was reading as much stuff as I could read, all the medical stuff, all the papers that were being published, because I wanted to learn, how was I going to help my patients with this? How was I going to help my family if they caught it? What was going to happen? And very early on in the spring of 2020, I saw a report from a post-mortem in Italy. And it said, we're very confused by the findings in the lungs of these poor people who died. There was a lot of hyperinflammation. There was some hemorrhaging, but there was also clotting. And there was a breakdown of membranes. And when I read that, I was like, that's from the mast cells. They're all caused by the cytokines that are released by the mast cells, So you've got histamine causing the hyperinflammation, you've got elastase 2 causing the breakdown of the membranes, you've got heparin causing the bleeding, and you've got some prothrombotic cytokines that cause the clotting. So I thought, well, these people, I don't think they're dying from the infection. I think they're dying from an overreaction of their body to the infection, because I think they're undiagnosed, untreated people with MCAS. Now, MCAS affects at least 20% of the population, and 80% of the MCAS sufferers are women. So that means it's more than 20% of the population, of the female population. We also know that 80% of them have hypermobility, and 30% will get interstitial cystitis. So that's the sort of MCAS silhouette, if you like. Yeah, phenotype, exactly. And so I was like, well, if these people are getting into difficulty with COVID, because most people who had COVID didn't get into difficulty, and they had like a flu-like illness or whatever, and they got better. But there would be maybe one person in the family, or the occasional person, maybe 20%, who were having difficulty. And in fact, some colleagues in America were having the same thought. And these guys are like the world global experts in MCAS. And they wrote a paper which was published on September the 10th in 2020. And it was is the hyperinflammation associated with COVID based in mast cell activation? And that was their paper. And that came out in September. So we were all thinking along the same lines. So they were treating their patients like I was treating my patients who I came across who had COVID, and I was treating them for the MCAS. So I told them, you take these vitamins: magnesium, selenium, vitamin D, vitamin C, quercetin, which is a mast cell stabilizer, and you take antihistamines, but you take them a lot. So you take loratadine 10 milligrams 4 times a day, and you stop drinking tea and coffee, and you have a low histamine diet while you're ill, and let's see how you do, and ring me tomorrow and let me know how you are. And people started ringing me, or I'd ring them, and they'd say, well, my cough stopped within 4 hours or 8 hours of taking the antihistamine. And I'd be like, great, that's what's supposed to happen, brilliant. And these people got better very quickly. And these were people who were just getting worse and worse and worse when I saw them. So that was really encouraging. And I ended up treating about 100 people, I think, with acute COVID. But then I started hearing reports about long COVID, and all the newspapers and the medical press were saying, we don't know how to treat this. This is a new condition. We don't know what's going to happen, blah, blah, blah. And I was thinking, well, actually, I just think it's ME. I think it's post-viral problem, and that the patients have got MCAS. And what we need to do is treat them. And people were saying, there's no treatment for it. We don't know what to do. And I thought, I think I know what to do. And I felt morally obliged to open a clinic because I just thought, first of all, I was curious as well. I thought I need to try this treatment on a few people who've got long COVID and see if I can make them better. And secondly, I thought I am morally obliged to do it because everyone's being told there's no treatment, there's nothing we can do for you, go away. And some people were being told it's in your head. You're imagining it. So, as they languished on their sofas and they couldn't cook supper for their kids, it's just like, no way. Anyway, so on the 1st of November, 2020, I opened a long COVID clinic, and I hadn't advertised or anything. I must have mentioned it to somebody who put it on Facebook or something. And within 36 hours, it was fully booked to the end of March. And I only put it in my diary to the end of March. So it was all the appointments were gone. And I was thinking, oh my God, when am I going to see the follow-ups? Anyway, we managed it. But anyway, so they started coming in, and I wanted to know, did these people have undiagnosed, unrecognized, untreated mast cell activation syndrome before they caught the COVID? Or did the COVID do something to their immune system to make them have this overreaction? And the answer is the former. So 99% of the patients I saw had a history suggestive of untreated MCAS. So what is in the history of somebody who has MCAS? Well, there's usually a family history. There's usually a family history of people who have chronic migraine or fibromyalgia or rosacea or psoriasis or ME or any of these symptoms, because I consider those to be symptoms rather than diagnoses, actually, because the diagnosis, to my mind, is MCAS, and it causes all these symptoms, or POTS, etc., dysautonomia. And so they all had a family history. Somebody in the family had IBS, chronic migraine, urticaria, etc. And then they had a history of maybe infantile eczema, maybe lots of infections when they were little, tonsillitis, ear infections, overreacting to insect bites. So everyone else just gets a little red bit, which is itchy for a couple of days. They get this great big swollen, lump. They would have maybe a history of, let's see what else, Epstein-Barr virus as a teenager. I'm not suggesting that Epstein-Barr virus causes MCAS, but what it does do is it just makes the MCAS worse and worse and worse. Every time they get these infections, they just get worse. And then they say, oh, well, after I had my glandular fever, I then became sensitive to gluten and couldn't eat that anymore, So it's just sort of ramping things up for them. So often, many of them have a history, and not all of them, obviously, of childhood trauma. And what childhood trauma does is, if you've got a propensity to MCAS, it's just terrible. I mean, it's terrible for anyone who goes through childhood trauma, and it's awful, and they need help and counselling, etc. But for those who have got MCAS, what it does is it tells the limbic part of their brain, we're in danger. We need to be very, very vigilant to try and keep you safe, because if you have childhood trauma, it's scary. And so the mast cells learn to be hyper vigilant and overreact. And so actually recognizing there was childhood trauma and getting some treatment for patients is super important, because you want to get rid of all the triggers. Sometimes these poor patients had been exposed to mold. They would have lived somewhere where there was some damp, especially when they were students and they go to university. Heartbreaking that they're paying a lot of money for some grotty property full of damp. And then they would say, well, it's when I went to university that my migraine started, that things just ramped up. And often at university, they're eating rubbish as well, aren't they? They're drinking more alcohol, and they're eating pot noodles and all this processed rubbish that's very high in histamine. And so that's not going to help them either. So it's like an assault on their already rather sensitive system. And then they get an infection. And then, like my Jessie, she had the swine flu, and then she just didn't really make much of a recovery after that. And so you get this history from them, but a lot of them, they were like, no, actually, I was quite fit and healthy. I just, I've just got a few funny little things, like I can't eat tomatoes or whatever. And so they were pretty healthy. And then they caught COVID, and then they didn't really rally. They did not get better. And so I started treating people for mast cell activation, and they started getting better. And the ones, the sort of 1% who had no history suggestive of MCAS, they got better within a week. I mean, completely 100% better in a week. The ones who had the MCAS took a little longer, but they would come back for a follow-up at 6 weeks. And they would all be saying, after 2 or 3 days of doing the diet and taking the antihistamines, I am definitely turning a corner. I can feel I'm improving. So that was really very satisfying. So we carried on doing that, and people were getting better and better. You were going to ask something?
No. I was just going to say that's amazing. I mean, well, thank you. That's the most, definitely the most well put together introduction I've ever had in a podcast. So thank you. And I think you've answered half my questions already, to be honest. But that was great. That's probably, we could almost end there. But yeah, I've now got a million T1 and 1,000 different questions. But just going back to your daughter quickly, you sort of mentioned that the lamb was the trigger initially. Do you think that was just the fact that the lamb was
minced,
and that was sitting out in the fridge? Yeah,
it was minced. And even though I had freshly cooked it for her, any mincemeat is full of bacteria, and the bacteria convert histidine to histamine. So that's why we don't have leftovers. That's why we don't have processed foods. And I recommend people have organic, freshly prepared food, avoid processed foods, don't have tea and coffee, really high in histamine. tea and coffee and green tea and alcohol and chocolate, I'm afraid, are a double whammy, because not only are they high in histamine, they also block diamine oxidase, which is the enzyme that breaks down the histamine. So you really want to steer clear of them. And I still get patients today coming who say, I think I've got histamine issues. These are my symptoms. And I say, well, what are you eating? What are you drinking? And they go, well, I have 2 espressos first thing in the morning, and then I'm having a low histamine diet. And I'm like, well, you're sort of actually, really shooting yourself in the foot with those 2 coffees. You're setting yourself up to fail. No matter how good you are through the day with your low histamine foods, if you start off with 2 coffees, then your bucket is overflowing and you're not going to do well. So often people think they're doing it right and they're not quite getting the whole picture. But yeah, so with mast cell activation, whether it's long COVID or just mast cell activation without having had COVID, the important thing is to eliminate all the triggers. So you mustn't have damp in your house. You've got to stay on a low histamine diet while you can, especially initially. You can usually start introducing some more foods once everything calms down. And certainly, I go out to eat in restaurants and things because I've got it too. And mine is another story. Mine came on from the injections, the COVID injections. So, when I eat out, I take some DAO before the meal, and maybe I might take an antihistamine because I know I'm not going to be able to control so easily what's in the food. But yeah, so my patients were getting better for the long COVID, and then they started getting ill again. And they started to get ill again in 2021 because they were going and having the vaccines. And the vaccine creates the spike protein in the body, and the spike protein has a great affinity for the ACE2 receptors on the surface of the mast cells and every other organ that's got ACE2 receptors in it. So then they were like, well, I was getting better. Then I had the vaccine, and now I'm 10 times worse again. And I'm like, oh no. So we've got to get rid of that now. We've got to try and get rid of that trigger. And that proved quite tricky because there wasn't a way of clearing it out of the body. And for 2 years, I was searching and searching. So I would tell people to do things like intermittent fasting, increase autophagy. That certainly helps, I think. Also,
Yeah, I was just going to ask about the autophagy side of it and fasting. Obviously, if there's a lot of inflammation in the body, you're going to struggle to sort of produce ketones to then get into a state of autophagy, obviously, because you're going to have high levels of fasting blood sugar due to the high cortisol. So were you then potentially, how were you helping people to maybe, educating them on how to eat around getting into a state of autophagy to sort of.
Yeah, well, we recommend the paleo ketogenic diet, and I know that if you know Dr. Sarah Myhill, my lovely friend and colleague, she's written books on ME and mitochondria and the paleo ketogenic diet, and she sees that as the cornerstone of reducing inflammation in the body. So we certainly do recommend that, and if people can, I think that the intermittent fasting is also helpful because it allows the body to rest. You're not digesting all the time. You're not, just allowing your body to just be calm. And to be honest with you, from a low histamine point of view, sometimes you think, oh, what the hell can I eat for lunch? Well, if you don't eat lunch, you don't have to worry about it. So it's like, well, just don't eat lunch, because when you go out, everything is sandwiches, everything is wraps, and there's nothing for people who are gluten-free, really, very little, or it's been sitting on the side and you think, I can't eat that because it's leftover now, and so actually just don't eat the food just have a really good meal in the evening, and that I think is better from a lot of points of view. And yeah, so we were doing that. We were asking people to take resveratrol and melatonin. And what else were we telling them to do? Melatonin, resveratrol, intermittent fasting, a couple of other things.
And your usual.
Yes, yeah, all the normal stuff. Type 1 antihistamine, type 2 antihistamine, mast cell stabilizer like ketotifen or quercetin.
Did you ever use cromolyn?
Yes, a lot. Okay. We use it a lot. So if somebody has eye symptoms, I always say, well, please buy Opticrom eye drops. If they've got lots of sinusy nasal drip kind of symptoms, Opticom nasal spray, but we can't get that in the UK anymore, which is really irritating. So use the eye drops in your nose, be creative. And then sodium chromoglycate is very good if people, especially if they have IBS symptoms and they have tenderness, where they can touch their gut and it's like, oh, that bit's always tender there. That's usually mast cells sitting in the wall. And if you take sodium chromoglycate, it can work like a dream and calm all that down, and often gets rid of diarrhea and lots of symptoms that people get, bloating, etc. So very important to look at the gut, very important to look at the microbiome. After COVID, both the infection and the injections, a lot of dysbiosis, an awful lot of dysbiosis. Every test we've done on people, really low lactobacillus, really low bifidobacterium, not good at all. So I tell them to take sodium butyrate and get those bacteria up. Protect the lining, please, because we've got a massive increase in bowel cancer now, massive increase. So in young people...
I assume on the probiotic front, you're not suggesting people take various bifido and lactose strains that are going to increase histamine naturally by themselves.
Yeah, you have to pick and choose. So we've got various makes that we sort of recommend, manufacturers. So, and actually, I'm very interested in the in your Vitality Pro approach, because you don't put excipients into things, and so that's I didn't know about your website or anything until now, until you reached out to me. So I'm very grateful that you did that, because I think you could be a very valuable resource for my patients. Because one of the things that some of the patients have is they can't tolerate anything. They can't tolerate meds. They can't tolerate excipients. Sometimes the med is okay. The medication is okay, but it's the excipient or the dye that is, so it's a real issue for them. And they can't even take supplements, a lot of them, because of the excipients. So something like, your website is a great godsend for us, really. So maybe you'll be able to tell me a bit more about that at some point. But so we were telling people to do what we could, and being as inventive and creative as possible. Also, ivermectin. Ivermectin actually does reduce the spike protein. It has about 20 positive effects on the body, and it's anti-inflammatory, anti-bacterial, anti-parasitic, which could be other triggers. So it's important. It's good. It works well.
Were you dosing that at 12.5 milligrams? Is that correct?
Well, 0.2 milligrams to 0.6 milligrams per kilogram body weight.
Okay.
Was what we were doing. We're starting with maybe 0.3 milligrams per kilogram. If they found it was really helpful, then to go up to the next dose. So, my clinic then started attracting people who are vaccine injured, who perceive themselves to be very sick after the vaccines. So, of course, with them, it was very important to try and get rid of the spike protein. And then in 2023, I came across an Italian group of scientists called the ZeroSpike Project, which were a non-profit making organization. And they were determined to find some way of clearing the spike protein from the body, the extracellular spike protein. And they had worked with ordinary NAC, and they had mixed it with the spike protein and looked at it under an electron microscope. And they could see that maybe 2%, 5%, 12% maybe of the extracellular spike protein could be denatured, split into 6 pieces by the ordinary NAC, and then the liver could actually excrete it through the kidneys. But as a whole spike protein, it can't, because it's a non-human protein. We've never made it before, and our body hasn't developed any mechanism for clearing it. So I'm afraid once you've had an injection, you've got it. It's there. And we need to clear it. We need help to clear it. And they were working with a quantum physicist who said, okay, so all the molecules in the ordinary NAC are identical, but some of them have got this potential and some of them are just asleep on duty and they're not doing anything. And it's all about quantum physics. and maybe the way they're looking, the way they're vibrating at a subatomic level, something is happening different in the same molecule. So he said, right, we'll make everything uniform. We'll make them all look in the same direction and do everything the same. And let's see if that makes it more powerful. When they did that, they then mixed it with the spike protein and it denatured 99.8%.
That's amazing. Has this been published at all? Because is this
Yeah.
the Augmented NAC
Yeah.
brand? Because I
Yes.
contacted them a while ago, just sort of because
Yeah.
it seemed to be too good to be true. When you look at the marketing claims, it's sort of the moment quantum comes into it, I think it's something everybody knows so little about.
Yes.
I
Yeah.
mean, it's sort
It's
of yeah.
They have got studies, and if you, in fact, I can put you in touch with them, and they can send you they've got a website full of all the studies and the data, and very interestingly enough, an independent research group in Japan contacted them and said, we've taken your augmented NAC and we've mixed it with spike protein, and under our mass spectrometry, we can see exactly where it's working and it's reproducible. And we can see that it's this particular bond here and this bond here and this bond here. And so it's absolutely, and they're just about to publish a paper on that, which is very interesting. They also developed a urine test, which tests the metabolites in the urine, and they were checking people's urine, and there were no metabolites of the broken down spike protein. And then they gave them the augmented NAC 3 times a day, and on day 8 they checked the urine again, and it was full of them. Now, I was also vaccine injured. And when I had the second dose, I only had 2 doses. The first dose didn't affect me at all. And I wonder whether it had anything in it, because they had 6 doses in a vial, and they were supposed to shake it and shake it and shake it between each one. And I got the top, which was all normal saline, and somebody got the bottom, which was all, it's possible. It's possible. Anyway, so I had no effect whatsoever. The second one, within an hour, I had a tremor in my right hand. I had eczema start developing on the back of my head, and I never had eczema in my life. I had rosacea come all over my face. My tongue started to swell up, and I had burning mouth syndrome, which was awful. It lasted 2.5 months. I had peripheral epilepsy, where my left leg just went into very alarming spasms. I couldn't stop it. And when I was sitting in a certain position on the carpet with my grandchildren, with my legs straight, which I'd always done and had no issues with, suddenly it was contracting, contracting, contracting. And it happened on 3 separate occasions, and I was very scared by that. Thought something very neurological is going on here. This has caused me neurological damage. I also had, suddenly my MCAS was on it was on fire. So I would eat my spaghetti bolognese and then my face would flush, and I knew that it was, and the next morning I wake up with a swollen face. I knew that I had full-blown MCAS because of what it had done to what the spike protein was doing to my mast cells. Well, I was the first person in the UK to use the augmented NAC because I managed to get hold of some from Italy. And I was like, I need this, I need this because I've got to stop this tremor, which had been going for 2 years, and my rosacea was awful, and so on. And within 24 hours, the second day when I woke up, the tremor had gone.
That's
which
incredible.
was unbelievable. And all the eczema was healed on the back of my head. Overnight, it had healed. And my skin started to improve. I never had the peripheral epilepsy again in my left leg. And it just was like, I could feel myself feeling healthier. I could feel my brain was clearer. Some of the brain fog was lifting. And it was just like, it was so, I like to use myself as a guinea pig. So, if, you have to know what you're talking about and experience it. And I was so thrilled. And I've had many, many patients who've had similar kind of experiences where they felt so much better, had more energy, more focus, more, so that's very good. Yeah.
Are you using sort of proteolytic enzymes alongside NAC to help sort of to break down the spike protein, or are you just running it in by itself?
I'm running it by itself. I normally tell people to take ordinary NAC in the morning, 600 milligrams a day for a week. And in the afternoon of those days, just for the week, take something like chlorella or activated charcoal as a binder in the afternoon to give them a liver detox, really, because we're going to ask their liver to work quite hard once we start taking the augmented NAC. And I've learned to say to people, start with 1 a day. for a couple of days. Then if that's okay, go to one twice a day, then go to one 3 times a day. And then you take one 3 times a day for 3 months, and then you go back to one a day. Now, it's important. You can get a detox reaction. And I had a detox reaction on day 6 of taking it because I went straight into 1 3 times a day. I was working in a clinic and I suddenly thought, oh, it's hot in here. And my face was getting redder and redder and redder. And then it spread to my neck. It didn't go any further down than that.
The
But I had a Herxheimer. Absolutely. It lasted 36 hours. It was getting better after about 12 hours, but it didn't go completely for 36 hours. Now, my husband had had 2 AstraZeneca as well, and he had had a stroke. He had a stroke 2 years after his AstraZeneca. Now, he's a very slim, fit guy. We eat very healthily. He doesn't smoke. He's really fit guy. He has no reason to make a clot. He has no cardiac arrhythmias or problems with his carotids or anything.
CAC, nothing like that.
Yeah, no, nothing. And he had a stroke. Thank God it was a very small one in his temporal lobe, and it's not left him with any problems. But so I was very keen for him to get on it quickly too, because we know what the spike protein does in the body. It causes blood clots to form in everybody. We've got microclots. When we do live blood analysis on all the patients, everyone's got microclots. And then in some people, it's going to make a heart attack or a stroke or a pulmonary embolism. And we've got friends who've died from sudden heart attacks who were perfectly fit and fine, friends who've died from strokes. And we've also had a friend who had bilateral pulmonary emboli, nearly died just within 4 weeks of having AstraZeneca. That was that one. But anyway, so we know it does that to people. So I was desperate to get it out of his system. And he went straight onto it 1 3 times a day. And the next morning he woke up with a headache, which was his Herxheimer, because he doesn't wake up with a headache. And he went and down, had some breakfast, and then he actually went back to bed because he felt so unwell. He felt very fluey, and it lasted about 4 hours. And he should have been drinking lots of water, because you should drink lots of water when you're doing this. But he was lying in bed, and I found him at the lunchtime. I was like, "Oh no, what are you doing here? Here's some water." And then he rallied and he got up, and we had a dinner party that night. So he was absolutely fine. Once it had passed, it was fine. But to try and avoid that for people, I now say to them, build up slowly, and just start it and build up to the 1 3 times a day.
Do you notice anyone who sort of follows these high sort of NAC protocols to struggle with any sort of sulfur or sulfite issues? I know the moment I touch any sort of high cysteine molecule, for example,
Yeah.
I almost instantly end up with at least symptoms of high sulfites, which I'm pretty sure is the case, because if I start to take sort of cofactors like molybdenum, etc., it definitely does
Sulfites, yeah.
ease it. Do you notice that with people who take?
To be honest with you, I've had about 3 patients not be able to take it, but only 3.
Okay, fair enough.
Which is encouraging. So, and they are very sensitive to everything.
Yeah.
And it's a real heart sink, because you think, oh, we want to get rid of the spike protein for you.
Yeah.
And we can't even do that. It's really tough for them.
Yeah. In those sorts of patients, are you running any sort of genetic testing? Are you looking at sort of just sort of any sort of polymorphisms,
Yes.
in the MAOI genes or things like that would sort of point to...
So we started doing that. I came across genetic testing with Jessie. So we'd managed to help her get a lot better, but she wasn't completely better. And I was like, she was still very vulnerable to her mast cells triggering, and she still looked pale and so on. And I was like, I think we need to know what your genes are doing. We need to know about your methylation cycle. We need to know, how do you metabolize histamine? Is it true? Anyway, one of the things we did do with Jessie was we did her diamine oxidase blood test, which you can have done quite cheaply on the internet for about 60 quid. And we did that for her at a lab, actually. And it came back as none.
That would explain a lot.
Yeah. So it literally came back. It said less than 2 or something. It said undetectable. So it was like, well, she's got so much histamine. The poor enzyme, as soon as it's made, it's gone. It was being used up constantly. And after at 6 months, we checked it again, and it was 23.5 or something. So she still has a problem with metabolizing it. The lab, unfortunately, this is just a warning to everybody. The lab will say anything over 10 is normal. It's not. Or it'll say histamine intolerance are improbable if it's over 10. But actually, the normal levels of diamine oxidase are 30 to 200. So anything below 30 is insufficient, right? And it just happens to be, if you've had loads of histamine, it's going to be lower and used up like Jessie's was, and you'll have a lower reading. But anyway, we did her genes, and lo and behold, when we looked at her histamine coping genes, she had very poor diamine oxidase production. And the company I use is called LifeCode GX. And I like them because they do beautiful reports, which are easy to read and to analyze and to talk through with patients. And patients
Was that Emma Beswick's company?
Yes, with
Yeah.
Emma. Yeah.
And she's incredible.
And yes. And so I didn't know anything about genetics before. And what I did was I found Emma online, and then I attended a whole load of her day courses, which were superb. And I'd recommend them to everybody, to learn about the methylation cycle, to learn about all of these things. It was great, really super. So I sort of did a crash course on them. And then we ordered it for Jessie, and Emma talked me through Jessie's results, which was fantastic of her, and started to get an understanding that she was, not very good at metabolizing histamine, but she was also not very good at detoxification and methylation. And there were she was on loads of vitamins and minerals, but there were a few gaps, like molybdenum or, chromium or something, so that she just wasn't taking. So we filled those. Oh, and she'd had, and one of the reasons why we did the life code test was because she had seen a colleague, Dr. Abby Lulsaget, who understands and gets MCAS and stuff. He's a fantastic endocrinologist. And he said he did some liver function tests and they were abnormal. Anyways, this is a young woman with abnormal liver function tests, very worrying. Then I was like, oh, we've got to do something. We've got to know what's going on at the micronutrient kind of level, genetic level. So we did the life code test, and lo and behold, she needed a few more micronutrients that we weren't giving her yet. And we gave them to her. And 6 weeks later, her liver function tests were brilliant, normal, pristine. Yeah, pristine. And you could see it. You could see it in her skin. You could see it in her face. You could see it in she could see it. You could see her liver was working properly.
Yeah, that by default will result in everything working properly.
Yeah.
The life code test, does that sort of overlay genetic data on top of sort of actual blood markers?
No.
Okay.
No, it doesn't.
Were you tracking those separately, things like homocysteine or?
Well, we weren't, and I'll tell you why. A lot of patients came to me having spent an awful lot of money, and their GPs won't do homocysteine. They won't do all these things, right? So if we had the life code methylation cycle, we could see that they probably didn't metabolize homocysteine away very well, and they probably would have a high level. And I know that's not terribly scientific because we didn't have any levels, but these poor people had run out of money a lot of the time. And also I found some of them had spent a lot of money having various cytokines measured and stuff like that. It didn't make any difference to my management, And at the end of the day, we had to go through the same kind of trial and error because what worked in one person didn't work in another. Now, it may be that in the future, they'll be able to hone down the tests so that will make a significant difference and help us to know, well, you're going to respond well to Montelukast, or you're going to respond well to whatever. But at this point in time, we haven't got that kind of data. So, I'm not a great believer in loads and loads of tests for test's sake, unless it's going to really influence what I do for the patient. And a lot of the tests didn't,
Yeah, no, I couldn't agree more. I think there's a lot to be said about needlessly testing inflammatory markers. If you have got an inflammatory condition, IL-6 is going to be high. You don't really need to sort of know that, do you? Dr. Piers, what are your thoughts on nicotine specifically? Obviously, that's sort of going around at the moment with its ability to sort of bind to the nicotinic and acetylcholine receptor and then potentially dislodge the spike protein.
I think it's helpful. Yeah, I think it's helpful.
Yeah.
I've seen it work in people. I think that it's useful. And I think that sometimes we were really worried about the smokers, weren't we? when COVID came along, I was like, oh my God, the smokers. But actually, they did really very well because they had nicotine in their system already. And certainly, a lot of patients are using nicotine patches and gum, and they're finding it gives them some relief and gives them a bit more energy, and they feel a bit better. So that is certainly an approach. And I mean, I certainly also think that ivermectin is very helpful in some of my patients. 50% of the sort of injection injured, the people with spikopathy, respond really, really well to ivermectin. And for some of them, it was life transforming. It meant that they went from not being able to sit up for more than 20 minutes at a time to being able to carry on a normal life. So yeah, I think these things are very safe and it's worth trying them. And we really want to be holistic in our approach, and we want to look at every element of orthomolecular medicine. I don't know if you've come across, I'm sure you have.
Yes.
Orthomolecular medicine, look at nutrition, where are the deficiencies? And that includes looking at the genetics, so you can see where the vulnerabilities are and which particular micronutrients people need more support with to help their methylation cycle and detoxification and so on. So looking at nutrition, and being, for the people with MCAS, it's a low histamine diet as well, maybe paleo ketogenic, etc. And then it's also looking at inflammation, which of course they've all got chronic inflammation, and doing the MCAS type treatments to bring that down, avoiding the triggers, getting rid of the triggers, getting rid of the toxins is the third thing in orthomolecular medicine. Hormonal balance, making sure that their thyroid is functioning properly, make sure that in women that their estrogen is okay and their progesterone is okay and their hormones are working okay, making sure the adrenal glands are working okay, and you haven't got adrenal fatigue, which you probably have in a lot of patients, and then also stem cells. Now, stem cells are the way we heal, and anything that can increase your stem cell activation is going to be a good thing. And I think autophagy has been shown to increase them, the activity of them a bit. But there are also some little patches that people can get, which are amazing. I've been using one for 6 weeks and they're incredible, and they stimulate your stem cells.
Yeah, I'm trying to get on the Christian Trebolo. I think he owns a company called STEM Regen, produces products that are reportedly supposed to release your stem cells. I've yet to actually understand completely how they do this.
Well, I'm using a patch, Rob,
Yeah.
that's got crystals in it that reflects your own body's light back into your body,
I've
and that stimulates. Have you heard of it?
I think is this the life patch or the life
Life Wave
wave? Okay.
X39, and it's incredible. There's no drugs, no medication, no stem cells from somebody else, nothing concerning like that. And it's a patch that you wear for 12 hours a day, and it reflects the light back into your body, because we emit heat and also we emit infrared light. So it reflects it back at a particular wavelength that will stimulate a peptide called GHK copper.
Copper, yeah.
Yeah, and the GHK copper it increases because of the patch, and then it goes and reactivates the stem cells, and then the stem cells are sent wherever they are needed in the body to heal.
I'm a bit suspicious of them, I'll be honest. Just looking at the data and just based on the amount of copper that they actually release, I often wonder if it's not just a better idea just to inject the copper peptide or take the copper peptide directly.
Well,
That's the cynic in me. So
yeah, well, there's quite a few studies which show an increase in the copper peptide levels when people do wear these. But what is also very convincing is the testimonials from genuine people saying how they feel on them. Now, like I said before, I like to test everything on myself. And so I came across these 6 weeks ago, and I've been wearing one for 6 weeks, a new one every day, but for 6 weeks, and I feel amazing. And I was thinking, I'll see, let's see. And I wasn't expecting anything to happen for months, maybe. I thought, I'll give it a year. I'll give it a fair whack and see what happens. And, I'm 65, and I thought, if anything is going to help me be younger, then I'm really interested at this point in my life. And as 70 was looming, closer and closer. And so I started wearing them 6 weeks ago. And the first day I had more energy. And I thought, well, is that placebo? Am I just, looking for something that isn't there? Well, every day since, I have more energy. I have much more energy. And I used to get a sort of dip in the middle of the afternoon when I'd want to fall asleep and have a siesta, and I don't get that anymore. I also felt more focused. I felt more motivated. I felt happier. I tidied my desk, which I've been meaning to do for about 5 years. And I'm now tidying other drawers and other places in my house, which is fantastic. Great side effect. I noticed within a week that I had reduced inflammation, signs of inflammation in my body. So, and I wasn't expecting that to show so quickly. I had big ridges in my nails, and by the end of the first week, they were smoother, which is extraordinary. By the end of the second week, an exquisitely tender spot in my neck, which I've had for decades, is 95% better. I can hardly find it. And then within 3 weeks, I feel like a well-oiled machine. I just feel like I can move. I exercise every morning. But I just feel, I do ballet, I do a bit of yoga, maybe some squats and things. I just feel like a robot. I just feel incredible. So I'm going to keep taking this and by 3 months, I should hopefully see some improvement in collagen production. And by 6 months, there's one of their studies, 15 people, 14 had reversed their heart age by 8 years in the study. So, and there are lots of testimonials of people coming off their medication and so on. So, I think, I think the science is sound, and I'm certainly experiencing good results.
Fair enough. Well, I'll have to revisit it, and if the anecdotes are there, and if people are experiencing these effects, then maybe it's not to be overlooked. Another question I'd love to ask is your thoughts on sort of limbic system retraining. I know you mentioned it earlier, and I'm sure you're familiar with programs like DNRS and the Gupta method. I think they have their time and their place. I think maybe initially, unless you've kind of got that sort of baseline level of support, they're maybe not as effective, and they're a bit like trying to put out a bushfire with a water pistol. But do you think those sorts of programs whereby you're essentially using a sort of a neuroplastic approach to sort of recalibrate the hypersensitive brain is effective? Or
Definitely. I would say, I think there's a Gupta has done Ashok Today study which showed a 30% improvement for people who were involved in the study. And I would say that I find that with most of my patients, not all, but most of my patients will say, actually, it does help. And they use various programs, not just the Gupta program, but they, use whatever they relate to. And I think people can say, I do feel about 30% better when I do that, when I'm involved with that, which is great. And, you want to, if you think about it, if you've been ill for a long time, if you've had childhood traumas and traumas through your life, then your brain is going to be super sensitive, and it is going to be looking out for you and too vigilant. And it's going to be in fight or flight the whole time. And that's exhausting. That's just absolutely plain exhausting. So you want it to calm down. So that, there's box breathing. There's all sorts of techniques, isn't there? EFT, EFTinternational.org is a great website to look at. There's all sorts of things that people can do to just calm down their nervous system and start to retrain the way they think. Instead of thinking, oh, how do I feel today? Oh, no, I don't feel very well, and this is awful, which is just going to become a self-fulfilling prophecy. You have to start thinking, I am walking towards wellness. I am, today's going to be a good day, and I'm getting better and better and better. And whether you do that through EFT or the Gupta program or, Susie Fern's program or whatever, it's very important to do it, and it shouldn't be neglected.
Yeah, just about refining that parasympathetic tone and getting the body out of that flight and fight sort of mentality. I was just going to say that sort of raises a question in my mind anyway, which is to sort of maybe talk about the mitochondria, because the moment you sort of start talking about, if that's okay,
Yeah, I love mitochondria.
Oh, okay, awesome. Then
Yeah,
we're on the same page.
yeah.
The moment you start talking about sort of sympathetic overload, you can start going down this cell danger response rabbit hole, which is something I find fascinating. I think Robert Navio's work is potentially, when you sort of take away all the triggers, it's arguably the root of why disease exists, at least in the chronic sense. Do you have an idea of maybe of what long COVID is doing to mitochondria, though, specifically to sort of get them into this stage where they're not producing essentially energy properly anymore?
It causes dysfunction. I'm not quite sure how, but it definitely causes dysfunction. And we see that in the patient's symptoms and how they are feeling. And there's another device which I recommend, and that's the ARC microcurrent device, which actually boosts mitochondrial ATP production 3 to 5-fold.
Okay.
And I've had some amazing results with that too. And I wear one at night when I sleep. Because, as I'm sure your listeners know a bit about mitochondria, they are the powerhouse of the cell, but they do more than that. They can affect your mental health. They can affect your healing, everything, your hormone production, exactly, your hormones, the balance in the body, the homeostasis of the body. And we have, in some cells, we have thousands, in some cells, we have hundreds. If you took all your mitochondria out and put them in a pile on the floor, it would be 32% of your body weight. And they make 70 to 80 kilograms a day of ATP, which is crazy. I mean, that's a huge amount of energy, but because it's used up as fast as it's made, it's gone, it's made and gone. So the mitochondria are super, super important to homeostasis, to healing, to hormone balance, to everything. And they can become dysfunctional very easily. For example, if people are on omeprazole, proton pump inhibitors, terrible. The mitochondria are full of proton pumps. So they inhibit the proton pump inhibitors of the mitochondria and make them dysfunctional. If people take statins, it reduces the production of coenzyme Q10, which is essential for the mitochondria. So, so one of the things we do say to our patients is if they're on any of those drugs, they have to come off them. And they do start to feel better because of that. And I recommend the ARC device, and I also recommend the food for mitochondria, iodine. Most of us are deficient in iodine, it turns out.
Carnitine.
Yeah, so
all your mitochondrial.
exactly, carnitine, magnesium, vitamin D, vitamin C. What else? B3.
B2,
niacinamide, B2, yeah. And get those into people, make sure you're giving the food that these mitochondria need. And then the little microcurrent device, you can wear it you can do up to 5 cycles a day if you wanted to, but you want to do at least 3 hours worth, which is 1 cycle. And I ask people to use program 1 and program 2. And it goes through something like 1 million different frequencies to find the right one for you. And it just depends. The programs give a different pulse rate to that microcurrent. And then it increases the ATP production literally 3 to 5-fold. And that has been shown in studies. And lots of athletes use them to recover from training or from a match, to give them quicker recovery from injuries. They're used on horses. There are equine ones.
Is this similar to a Rife machine by any chance?
Well, it's based on the same kind of principle, but it's better, I think. I mean, Rife machines are doing something different, aren't they? Rife machines are looking at all of your different frequencies to see where the imbalances are in each particular tissue. So that's sort of more the Rife side of things. And then they can treat you by giving you the right frequency to get things back into the right frequency. But this is about giving you a microcurrent that just boosts your ATP production. It's amazing. I have seen some small miracles with it, literally. I had a lady who had chronic joint pain for 7 years. And she tried everything to get rid of this pain in all her joints. And I said to her, please, please get the ARC. And she got the ARC. And she said within a week, her joint pains were settling. And by 2 weeks, they'd gone. And her husband, who had been a cynic, was a firefighter, and he was off duty waiting for an operation on his shoulder because he'd injured his shoulder, presumably lifting somebody down from a fire. And he was a great cynic to begin with and said, oh, what are you buying that for, And then when he saw the response in her, he bought himself one. But they could have shared the same one, actually. But he bought himself one, and he could cancel his operation. He could go back to work. He didn't have to have the operation on his shoulder.
That's incredible.
Yeah.
Dr. Piers, we were chatting about hormones earlier, and I'd just sort of love to revisit that topic, if that's okay. When you start to work with somebody who's obviously got long COVID, or I suppose any sort of post-viral fatigue, you're obviously going to run into issues with hormone production. Both sort of sex hormones, reproductive hormones, as well as your thyroid hormones, etc. How do you approach how do you approach replacing hormones specifically? Do you sort of go after thyroid first and then go downstream of that, or do you sort of go straight to replacing reproductive hormones in your patients and your clientele who've got these post-viral fatigues?
So usually thyroid. Get the thyroid right. The thyroid is the conductor of the orchestra, and you've got to get the pace right, haven't you? And so we look at the thyroid, and unfortunately, endocrinologists, fortunately, will say it's best if your TSH is less than 1.5. The labs tell the GPs that it's okay if it's up to 5 sometimes, or which is crazy, because it means that an awful lot of people are dragging themselves around with hypothyroidism, in my book, and feeling under par, overweight, can't lose weight, skin dry, can't think clearly, etc., because they've been told their thyroid function is normal, when actually it's not optimal at all. So we look at that very much so. And then it's about, sorry, were you going to say something?
No, I was just going to say it's music to my ears, because I've just met so many sort of clinicians who sort of will just directly treat with reproductive hormones, estrogen, progesterone, testosterone, whatever's required, without realizing that you actually need a healthy thyroid. You need those healthy levels of T3 to increase that star expression, to then get the cholesterol into the mitochondria, so the little mitochondria can actually make the hormone to begin with. So you're sort of then putting the cart before the horse in some respects.
Absolutely. You've got to line up all your ducks, haven't you?
Yeah, and it just speaks to the sort of, well, obviously the beauty of the system as well, but just the fact that medicine is just so siloed, and the fact that it just doesn't work when you sort of look at every sort of system in the body in isolation. You've sort of got to understand it. You've got to understand the fact that, yeah, the immune system is ultimately going to control a lot of this, but at the same time, if you don't have a decent understanding of the gut, you're not going to be able to sort of help somebody to improve their immune system function.
Absolutely.
And yeah, no,
absolutely. And the mitochondria are very important in the immune system, aren't they?
Yeah,
so they
definitely.
control hormones, and they control homeostasis, and they control the immune system. So they have such an important role to play. We've got to guard them with our lives, literally, and make sure that they're happy and healthy, and that they're given all the hormones are in balance. And so I look at the thyroid, look at the if a woman's perimenopausal, has she got mast cell activation or not? Now, if she hasn't, it's simpler. We can go in with the HRT. We can do some estrogen replacement, progesterone, and we can do testosterone if it's needed. And it may not be needed initially, but it might be needed later on. And but if they've got mast cell activation, we have to address both. We have to address the mast cell activation as well if we're going to stand a chance of getting them to be settled on some HRT and benefiting from it. Yeah, so it's a little bit more complex for them, but we patiently go through it and we get there.
Yeah, I recently had a discussion with a functional health coach in the States called Sonia Spill, and she said essentially the same thing. You can't sort of treat a woman going through menopause just with HRT and expect them to sort of just necessarily move through it. I don't know if you're familiar with Dr. Eric Volkovich, who's a thyroid physician, but he, again, utilizes the same methodology. But in his case, he talks about this concept of adaptive physiology, that we look at dysfunction as dysfunction, and we should really ultimately start to look at it as physiology that has become, that is adaptive, that is such as to say that it is adapted to the current state of the body. So if the body is an allostatic, is going under a high allostatic load, is an allostatic stress, then physiology is going to adapt to that, and that you can't sort of out-drug that just
No.
because you want to.
No.
So yeah, you can throw
No.
all these chemical signaling molecules at the body, aka hormones, if you want, but if you don't fix the underlying physiology, you're
Absolutely.
going to have problems.
Yes, which is where orthomolecular medicine comes in.
Oh, definitely. And
Yeah.
do you do any direct nutrient testing when it comes to orthomolecular medicine, or do you?
We do do some hair testing. If some of my patients have gone for that, which is great because it's cheaper than some of the other testing, and you can get pretty good evidence and information from that. Yeah, so we do. I'm getting more and more into orthomolecular medicine. I must say, there's a very good orthomolecularmedicine.org, I think it is, website, and they're fantastic articles written on there.
Yeah, Dr. Damien Downing, who's I know
Yeah,
quite well, is I think I don't know if he's the editor of that, but he's I'm
he's
sure
involved.
yeah, I'm sure you're familiar with Damien. I think he's in charge. I think he's still the president for the BESM, the British
Oh yeah,
Society for
yeah,
Ecological
ecological
Medicine.
medicine. Yeah,
Yeah, no, they're an amazing initiative, and they put out a
yeah,
lot of incredible information.
yeah. Yes, I guess you can go onto their emailing list at the orthomolecular medicine website, and every week a really fascinating article drops into your inbox, yeah, really recommend it.
Yeah, no, I think it should be the foundation of medicine. You should sort
Yeah.
of course, there are always instances where you're going to want to treat with pharmaceuticals, with supplements, etc. But you've got to understand the basic biochemistry of the human body, and realize that if you are missing just a couple of nutrients, you can throw the whole system completely out of whack.
Yeah, we're very delicate, actually, aren't we? We're
Yeah,
really in fine balance. And the problem is there's so many toxins in the world,
that was my next
in the
question.
water, in the air, in our food, the pesticides, insecticides in the soil. There's so many toxins. Our bodies are having to detoxify constantly, and it's using up the micronutrients on a grand scale. So when sometimes patients say to me, "Oh, but I have a good diet. I don't need to take any supplements." It's like, well, unfortunately, that's not probably quite sufficient these days.
Your
There's
biology doesn't agree.
Yeah, your biology is telling me something else, and it's just the sheer toxic load is using up things that should be just left for some nice healing processes, etc., or homeostasis, and instead it's being used up to clear some of these toxins. So, yeah, I think that we all need to be very aware, and it has been suggested that it's a good idea to have your hair analysis done certainly once a year, maybe every 6 months, to make sure you're on track.
Yeah, no, I don't know too much about hair mineral tissue analysis. I'm sort of more familiar with the traditional sort of functional medicine labs in that respect. A lot of your gone straight on my head. Genova Diagnostics have got a specific panel, the metabolomics panel, for example, or your organic amino acids tests. Although I'm not entirely sold on organic amino acids either, because then you're looking at urinary metabolites. And is that a true representation? I don't know. I still think ultimately serum testing is probably your best bet. But then you've sort of, yeah, that's obviously gets very pricey very quickly.
Yes, yes. And these poor patients, a lot of them, they not only are they unwell, because they're unwell, they can't earn any money, they can't work effectively, they're working very part-time, or they've stopped work altogether. So their income has dried up,
Yeah,
and we have to be very careful about, not putting them under more pressure and
yeah.
stress.
I think Dr. Sarah Myhill, who you mentioned earlier, and we interviewed in the podcast as well. I think she called them PBs, poor bastards, and
Yes.
it is very.
She does. Yes.
Yeah, she's very direct, as Dr. Myhill.
She's fantastic. So she's an RB, which is a rich bastard, apparently.
Fair enough.
So we're all rich bastards, and yes, a lot of the patients are PBs.
Yeah. Just quickly going back to Dr. Myhill. Obviously, she's a proponent of the ketogenic diet, and you've mentioned that already. Do you find long-term that a ketogenic is sustainable just from a hormonal perspective? Obviously, some women and a lot of men are going to struggle with a long-term absence of carbohydrates, just because carbohydrates, they obviously modulate things like sex hormone binding globulin. They are essential to some extent anyway in thyroid function, and it's affected me personally. I know when I've sort of maintained a long period of being in a ketogenic diet, my free T3 drops tremendously.
Does it?
Yeah. Do you find that at all with the patients you work with?
Generally, what I do is say to people, and I don't know if this is incorrect really, but I usually say, try and be carb free during the week, and then allow yourself a little bit at the weekend.
Of a refeed,
yeah. It's just a little, because from a psychological point of view too, it's not a bad thing. And if, as you say, if it's something that they need a little bit of, then having a one meal with a bit of carb in it at the weekend is not a bad thing. But a lot of my patients are also going carnivore, which is interesting.
Yeah, I think and I'm a proponent of the carnivore diet. My only concern about the carnivore diet is there's just no long-term data. I know data isn't everything, but just I think monocolonization just sort of the gut constantly sort of jumps into my mind. And what is that going to ultimately do from an immunological standpoint at the end of the day? I don't know, and I don't think anyone does.
Have there been studies to show what the microbiome of people who eat carnivore is like over long term?
No. I think
that's what we need, isn't it?
Yeah, the longest. I mean, how do you run a long-term dietary intervention though? That's the age-old question.
Yeah.
There is data to show that there is minimal change in the gut microbiome on a carnivore diet, but that study lasted all of 14 days.
Okay.
So that is hardly.
So it's not long enough.
No, not even close.
No. But it's an interesting topic, though, isn't it? And I've had people contact me and say, there's one guy in the States, and he emailed me and said, saw you on a podcast, and I just wanted to tell you the carnivore diet has changed my life. I was covered in psoriasis. Look at these photos. And over a 3-week period, all his psoriasis went because he'd gone carnivore. And he's got a website. It's something like sorry, as in from psoriasis. I can't remember anyway, but it's very interesting. And he's got a whole community of people doing the same, and they're all finding that their inflammation goes down in their body and they do very well.
Yeah, I think it's a great diet. I think it's a tool. It's in the toolbox.
Yeah.
And I think it really can help when you're in this sort of hyperactive immune state and everything is just flaring you, and you need a way to reset without necessarily starving to death at the same time.
Yeah.
I do know that a lot.
Go on. So no, Jordan Peterson's daughter. Do you know about her?
Michaela Peterson. Yeah, she's been on a carnivore diet for years, and
she has.
I think she is maintaining a carnivore diet during her pregnancy at the moment as well, which is brave, although I think she's just an outlier. I mean, the moment she, by her own admission, reintroduces anything, and she has, from my understanding, tried to reintroduce sort of fruits and certain vegetables that you would think to be fairly benign, like white rice. She just instantly has flare-ups in her
joints. It was
joints and stuff. I think it was.
Didn't she have sort of juvenile
rheumatoid arthritis?
Yes,
that's right. Yeah.
Right. Poor thing.
So,
awful.
Yeah.
Awful. But she's not on any drugs, and she's actually pain-free, and she's on the carnivore diet, which is amazing.
Yeah, I've heard it from some sources. I mean, this is just pure conjecture that she does take thyroid medication, but then I take thyroid medication, so that's hardly.
That's not a great big deal, is it?
No, not really. Not at the end of the
No,
day.
it's not the end of the world.
No,
But
definitely not.
there are worse things. But certainly having juvenile rheumatoid arthritis is terrible.
No,
And
it's not something I think
no,
anyone would want. Dr. Pierce, I know we're starting to run up on time, so I think I'd love to ask if we could just put this all together for the listeners, because we've obviously covered a lot. And then I've just got a few rapid-ish fire questions I'd love to ask you, if that's okay.
yeah.
But for someone who is struggling with long COVID, going through long COVID, where would you suggest that they begin? If you were to provide, obviously, just a basic framework that people could follow to at least start to get their symptoms under control, and then maybe see someone such as yourself if they are still struggling. Where would you begin?
I would begin with making sure you get rid of all of the triggers, and that includes being on a low histamine diet and being very honest with yourself about what you're eating and drinking. And is it really high histamine? If it is, then I'm afraid it means doing without. So I would start with the diet, what you're putting into your body, because that's so important. I would look at I would also look at triggers like mold in the house, which is very common in this country. And sometimes it's even hidden. You know, you can smell it, but you can't find it or whatever. So it needs to be sorted. And I would also look at taking antihistamines, try type 1s, try adding type 2s, see if they make any difference to your symptoms. I would look at the genetic side of things. I think that's very helpful. And taking supplements, very helpful. You want the ones that are as pure as possible, which is where you guys come in. Yes, and making sure you if you have any deficiencies that you're covering them, cover your bases. And being aware of your genetics is helpful, because you can then work with your genes rather than against them and support them, and that can make a huge difference. And then I would also consider trying, you can buy over-the-counter quercetin, and you can take organic dandelion tea. Dandelion tea is full of quercetin, and 3 mugs a day, that's pretty good. On a sort of continual basis. So you can stay away from pharmaceuticals if you really want to, but you can also turn to things like ketotifen, which is a very useful mast cell stabilizer. And some of my patients use that to very good effect. It can make a huge difference, but then they can come off everything down the line. I'm not saying necessarily all these things need to be taken forever, but we can hopefully wind them down as the system stabilizes, as the mast cells calm down, and then have them in the cupboard should you have a flare. And people start to manage themselves very, very well. There are other things like low dose naltrexone, which can be very, very helpful. And I have, again, some miracles with LDN, for whom, some people for whom it has given their life back. I would definitely get rid of the spike protein with the augmented NAC. I think that's an absolute must, because whilst that's still around, and we know it's very toxic, we know the microclots I mentioned, but it also causes immunosuppression. It also causes inflammation like myocarditis, pericarditis, encephalitis. We know it also downregulates 3 cancer protective genes and upregulates 17 cancer oncogenes. So better not to have that in your body, I reckon.
No. Definitely not. I think it's definitely an amazing place to start. Okay, if you wouldn't mind, we can just run through some rapid fire questions. They're never rapid. They never sort of end up being
I'll
rapid.
do my best.
But so don't worry about it, is what I'm saying. I don't think I've, with the exception of maybe one guest, I think they go on and on, which is great as well. So, okay. Cool. Let's start with this one. If there was one lab test that you would recommend to people to sort of identify long COVID, what would it be?
To identify long COVID, I'm not sure that there is a lab test, really. I think it's useful to know the diamine oxidase before they make any alterations to their diet. And also, actually, spike protein antibodies. Spike protein antibody test could be useful.
Yeah, I wasn't even aware you could get a spike protein antibody test.
You can. And actually, that's probably the one I would do. if I was going to choose one, it would be the spike protein antibody test.
Okay, perfect. What do you think the most common mistake doctors generally make when treating patients with long COVID is?
They probably don't understand completely about mast cell activation syndrome. That might be the mistake. It might be also the fact that they maybe don't appreciate that childhood trauma needs to be addressed as well. Although there's an increased awareness about traumas being important and significant. I can't think of anything else really. Maybe, I think one of the difficulties people have is we ask them to go on a type 2 antihistamine and then the GPs won't prescribe it. That's a real problem. They can't see why they need it, but they are really absolutely... Now, some of them don't respond to it, in which case they don't need it, but they should try it for a month. And others, it can be absolutely transformational.
Isn't there some long-term data, or some data to show that long-term use of, I'm not sure if it's H2 or H1 antihistamines can at least drive up the risk for developing certain neurological disorders later on in life?
It's a bit patchy, that. And I asked my colleagues in America about this because I had patients asking me, and I thought, well, I'll go straight to the horse's mouth and talk to these experts in America who have been treating people since certainly the 90s. So they've got more experience. And they said they have never, ever had any issues with, and some of their patients need to be on type 1 and type 2s chronically. And as soon as they try and reduce them or come off them, they have an issue. And they said there's never been any neurological detrimental effects that they are aware of or have seen. So they were very reassuring. But obviously, my goal is to get people off everything, and to, once things are calm, to actually then reduce all the medication one by one, not all together, and in a very gradual way. So like you add them one by one gradually, you take them away gradually one by one, and you see if it makes a difference or not. And if it doesn't make a difference coming off it, then you come off it, which is great.
Yeah, I think it's all about trying to get the immune system into the most quiescent or sort of calm, stable state that it can be in, and then hopefully, I think ultimately it's about controlling stress at the end of the day, sort of dealing with things like childhood trauma, as you mentioned, because ultimately the body doesn't sort of differentiate between sort of physical and psychological stress, does it?
No, it doesn't.
If you've got this high level of psychological stress, it's going to constantly drive that sympathetic immune, that tone, which is going to then upregulate the immune system, and then you end up back at square one. So, which is easier said than done. Cool.
Hypnotherapy is quite good.
Okay, I've not done that for a while.
I have a fantastic hypnotherapist who works, we refer people to her, and she's getting incredible results.
That's interesting.
Really. In 6 weeks, she does 6 sessions with people, 1 a week for 6 weeks. And amazing results. So I'm really thrilled that she's that she's doing that.
Okay, you've shot my LDN question straight in the foot because you've already answered it, I'm afraid. So I'm going to ask you another one. Have you ever experimented with, that sounds experimented with patients with drugs? Can I say that? I'm not sure. Have you ever trialed low dose Abilify in any of your patients?
Sorry, which one?
Low dose Abilify.
No, I haven't, is the answer to that.
Okay, fair enough. No, it's quite an interesting compound that's sort of being played around with. I'll use that term loosely in the sort of the CFS community. It seems to be a partial agonist of the D2, and then I've got to get this right, the 5-HT1A receptors, and it drives more. It drives the glial cells more from an M1 to an M2 macrophage phenotype. So it then down-regulates a lot of that sort of that sickness behavior, and improves the dopamine tone and reduces a lot of that neural inflammation. So
I don't know about that one.
Yeah, no, it's I think it's being dosed in the sort of the 1 to 5 milligram range, which for obviously an antipsychotic is pretty low, but I mean that's ultimately what you wanted at. But it's
Yeah.
a compound that does seem to be effective when maybe somebody's unresponsive to something like LDN. And I've known a few people who've taken LDN and they've taken it for a while, and then they don't become intolerant to it, but they become insensitive to it. I mean, I'm sure we could have a whole different discussion about receptor insensitivity and various compounds. But yeah, I think it's another tool in the toolbox that is quite interesting.
Interesting.
Okay, I think that's it, Dr.
There's,
Piers.
shall I just say one more thing?
Mhm.
There is one drug that we're using in our patients post-COVID,
Mhm.
and it's getting hold of it that's the tricky bit. It's called sulodexide, and it has low dose heparin in it, and it has a sulfoxide group, and so it has incredible properties, and it dissolves the microclots, and it also repairs the endothelial lining of all the circulation, which is damaged by the spike protein, because the endothelial lining is full of ACE2 receptors, and people. It's very safe to take. It was developed 30 years ago for varicose veins, and it's available in Europe, in quite a few European countries, over the counter, in fact, in some. So it's Spain, Portugal, and Italy, I think. You can buy it over the counter. And when people go on that, they can often feel very much better.
That's perfect. We'll definitely do some investigations there. It's
Yeah,
something
I
that
can
sounds
send you some papers. I'll send you some papers about
definitely.
sulodexide. Yeah,
I'd love those, and we'll obviously stick them in the show notes too for anyone who's interested
yeah.
in investigating that further. Dr. Piers, thank you so much for your time. Where can we direct people to find you?
So I've got a website which is menopauseconsultancy.co.uk. That's probably the best one. There's quite a lot of information on there about the approaches that we take, and the information about histamine and mast cell activation and so on. And then there's also various associates who we work with, who we refer people to on that website. And a few products that I recommend, and how to order the augmented NAC is on my website. If you look at the self-help section and drop down, then there's some recommended products, and that gives people the link for that if they want to get hold of it. And so that there's quite a lot of information there. And if they wanted to have an appointment with any of my colleagues, you can book online. But I'm fully booked, I'm afraid, so I'm not on there.
Fair enough.
Just,
Perfect.
yeah,
Well, we'll link to all of that in the show notes. Thank you so much
lovely.
for your time. This was an insightful conversation, and I hope people are able to take away at least the fact that there is hope, if nothing else, from this from our talk today. So, yeah, thank you for your time.
It's a pleasure. Thank you for inviting me.